What questions should I ask my surgeon during my first visit? Here's some important thoughts. You've been referred to a surgeon. Typically, that referral is after a diagnosis of breast cancer has been made. On some occasions, it'll be that you're referred to a surgeon because you have abnormal mammograms or an abnormal ultrasound, and the surgeon is seeing you prior to any core biopsies being done. But let's assume, for the sake of this video, that this is your first visit with a surgeon and you're now newly diagnosed with breast cancer. Now, at Breast Cancer Answers, I have a PDF that you can download that gives you a list of questions that will help you for that visit. But I'm going to also share some additional thoughts with you today that I think will be helpful. Number one question is, why am I seeing a surgeon? Well, typically the answer is the surgeon is the first specialist that you generally see. Historically, often surgery was done first, but that may not be the case any longer, particularly if we do chemotherapy up front. Now, the other questions that are important here, you want to know about the experience of your surgeon. You want to know if the surgeon is a member of a multidisciplinary team. You want to know if you're newly diagnosed, is your case going to be presented to a multidisciplinary tumor board where other experts chime in about your best management. Please remember that the treatment of breast cancer takes a team of people, and please also remember that breast cancer is a galaxy of diseases for which we're trying to personalize the treatment for your individual case. Also, the question may come up, do you need to be seen by a genetic counselor? Or even at that first visit with the breast surgeon, this question may need to be raised if you have a strong family history of breast cancer, and particularly if you're age 49 or younger. Then, if you're at the point, and usually not during this first visit, to discuss surgical options, you may also want to know, do you need additional imaging studies, such as a breast MRI, before you can get into the details of the various surgical options that will be available to you. Always on the mind of the newly diagnosed breast cancer patient is, am I going to need chemotherapy? And that may or may not be known during that first visit. With instances of HER2 positive breast cancer or triple negative positive breast cancer, the answer is yes, you're absolutely going to need chemotherapy. And in most centers now, that chemotherapy is done first before any surgery is done. So you see, you need to go into those sort of visits really armed with questions to be asked. How is the treatment plan going to be done for your individual case? What are the pros and cons of the options that are available to you? And again, is the surgeon part of a multidisciplinary team? Do you know that not every breast cancer patient needs chemotherapy? Now there's a way to decide if chemotherapy will benefit you based on the unique biology of your tumor. To learn more about the Oncotype DX test and how to discuss it with your doctor, click this button.